Hi, I'm Elisa Lamel, Legal Content Specialist at Krause Financial Services. In this video, we will explore the legislative history of the Medicaid program and gain a better understanding of how this public health program became the assistance program we know it as today. The very concept of a Medicaid program was first realized in the Social Security Act of 1965. This act included Title 19, which explicitly established the concept of a Medicaid program. This program was created to provide affordable health care to low-income families and the elderly. A little over a decade later, additional legislation was passed to reduce overall Medicaid spending. The Omnibus Budget Reconciliation Act of 1981, or sometimes referred to as OBRA 81, redefined the eligibility standards for recipient coverage groups and reshaped the program's operation efforts. OBRA 81 reduced matching percentages, extended payment standards to inpatient hospitals, created the waiver program, and required payment adjustments in states that served a high number of Medicaid and indigent patients. In doing so, this act changed the benefit capabilities the program was able to provide to recipients. Shortly after the passing of OBRA 81, the program was redesigned with the passing of the Medicare Catastrophic Coverage Act of 1988, or MECA. The goal of MECA was to reduce the financial risk and strain associated with the costs of illness and long-term care for the elderly and their spouses. This led to new regulations regarding spousal impoverishment protections and revised standards concerning the attribution of income and resources between the institutionalized spouse and the community spouse. MECA also established the look-back period and the formula for determining the community spouse resource allowance, the personal needs allowance, and the community spouse's monthly maintenance needs allowance. Following MECA was a second Omnibus Budget Reconciliation Act, referred to as OBRA 93. OBRA 93 completely redesigned eligibility requirements and imposed strict limitation on individuals from rearranging or transferring their assets. The most notable change resulting from OBRA 93 was the extension of the look-back period from 30 months to 36 months. OBRA 93 also provided the framework for calculating an applicant's period of ineligibility, which is still implemented for penalty period calculations today. This act also established the ability of state Medicaid agencies to mandate recovery of benefits paid on behalf of the recipient for long-term care services from the recipient's estate. As we can see, many of the provisions of this act began to shift the emphasis of previous legislation from friendlier safeguards to prevent spousal impoverishment to stricter provisions on spousal transfers and preventing fraudulent eligibility claims. When it comes to Medicaid planning, the most referenced piece of legislation is typically the Deficit Reduction Act of 2005. One of the most notable outcomes of this act was the expansion of the look-back period to 60 months. The DRA also redefined the start date of an assessed penalty period and provided new instruction as to the treatment of annuities pertaining to eligibility determination. This revision of current Medicaid regulations also included revised rules on reverse mortgages, eliminated the option to round down fractional penalty periods, expanded the hardship waiver, and provided greater freedom to individual states to impose and modify their own state-specific Medicaid programs. It was the newly expressed treatment of deferred and immediate annuities in this act that led to the creation of the Medicaid-compliant annuity. The Affordable Care Act of 2010 was the most recent legislative action to impose new rules on the Medicaid program. In addition to standardizing the eligibility rules and application process, the ACA expanded Medicaid benefits for people with disabilities to include all Americans younger than 65 whose income was less than the federal poverty guidelines. As we can see, the Medicaid program has slowly evolved over the last few decades to become the program we recognize it as today.